Schools around the country and parents are weighing the risks of children resuming in-person learning during the Omicron spike. In Chicago, teachers are refusing to return to the classroom because they say it's not safe. They don't feel safe. But some parents say they are comfortable sending their kids back.
I would have sent him back 5 days a week with the mask on in September of 2020. I will send him back as soon as he can go back in. He's back in. My son's fully vaccinated. We have him tested regularly, and you wear a mask and you send your kid to school. I feel like I have very little say in what happens. And I'm a pretty involved parent in my son's school. But I feel like I'm completely at the mercy of what the union wants to do.
There are so many different opinions. Want to bring in internist and pediatrician Dr. Frita Fisher. Doctor, parents are frustrated and worried, concerned, and so are teachers about the risk for kids in the classroom because it is so transmissible.
Hi, Susan. Parents have a very great reason to be worried and concerned. And yes, Omicron is very transmissible. But the good thing is that we know what to do. We have the proper mitigation measures. And so if schools just follow proper protocols, if they have good air ventilation, if they require masks, and if they require proper masks like N95s, KN95s, KF94s, and if they have contact tracing, that will help to make schools very safe. Parents are also concerned because being out of school, having virtual school, has its consequences as well.
And Dr. Frita, one prominent children's hospital recently came out in support of getting kids back in the classroom. Is this because Omicron maybe is less severe for those who are vaccinated?
It does seem right now that Omicron is less severe. We are seeing huge spikes in cases because it's so transmissible, but we're not seeing those same huge spikes in the hospitalizations. And so that has something to do with it, but also because we know so much on how to keep children safe in school. As long as the schools will implement those practices, then the best thing is for children to be in school.
Yeah, and interaction is so key, as you know. Isolation's difficult, and it's difficult really at every age. Middle school, high school kids missing prom. How do we balance that in terms of their mental health and students and being among friends and not being isolated? It's tricky.
The good thing, Susan, is that our children are resilient. I have a teenager, and then I have two children who are 11 years old. And being home really was quite the challenge. Some students are able to study well and do fine and figure out ways to have fun in isolation, but other ones really do need that one-on-one social interaction. And so it's important to be honest with children. Let them know what we don't know when they ask you exacts, like when is this going to be over? When can I go to school? When can I be face-to-face with my neighbors with no mask? Let them know that there are certain things that we don't know and that they have to be patient. Most importantly, you want to check in. Ask your child how he or she is doing, and don't be afraid to seek counseling to help to get through this, not just for your children, but for yourself as well, because these are unprecedented times and we all could use the mental support.
Absolutely, well said. And you know, Georgia public school teachers who test positive for COVID can return to school if asymptomatic and masked. Here's what's tricky. Every state is mandating different things for different schools, so you don't know what to do as a parent. You're thinking, wait, if they're asymptomatic, can it still transfer? What kind of mask? And it's really difficult for everyone.
It's very difficult, especially when the leadership is often not giving us the best or the safest practices. The tricky thing with COVID-19 is that you can transmit it even when you're asymptomatic. In fact, most people are symptomatic. Most people are transmissible 2 days before they have symptoms. You are able to infect other people 2 days before you even have any symptoms. That's why the contact tracing has been so important in helping to slow down the transmission. And so when you say that teachers can go back to school, even if they test positive, as long as they wear masks, well, quite honestly, many of the schools in Georgia have no mask mandate. And so who is going to be the person supervising to make sure that these teachers who test positive are wearing masks? No one. And so that really puts us at a high risk of continuing the spread of COVID-19. And if we continue to spread it, it will replicate, it will mutate, we will have more variants. and we won't be able to get out of this pandemic as quickly.
It feels like a mess, and we're just 9 days into the new year. I'm hoping we come together as the United States of America and really have this be the last variant I'm hoping for. Dr. Frita Fisher, thank you.
Thank you.